Hello, my name is Michelle Kelly, and I'm an associate professor at the School of Nursing, Midwifery and Paramedicine at Curtin University. The area that is my focus and my portfolio is simulation and practice. And today I'm going to present my session giving you some idea about thinking and teaching differently to maximise learning. Moving on to the next slide. This is the abstract that I based this talk around. And although the conference that was scheduled in Hong Kong was based around technology-enhanced learning, I'm going to give a slightly different approach and acknowledge technology as providing greater diversity in approaches of learning, particularly augmented reality and virtual reality. It's a very exciting time in education. But beyond the excitement of using new things, I believe the focus should always remain on learning about or refining clinical practices for safe patient care. That's really a global incentive. And over the last 20 years, there has been a rapid uptake of simulation-based education, as one example, across health disciplines. Nurses and educators are creating diverse learning experiences for students and clinicians, many using what I would call low-tech equipment or simulated participants, simulated patients, which can create highly emotional simulation experiences, which can be transferred to practice. So I guess I'm giving you a different spin on the technology and featuring some technology-enabled learning approaches which do touch on simulation-based education. There are some online learning resources that I will share with you that are interesting initiatives. So just to set the context and to make you aware of useful 2019 publications in the maturing field of simulation-based education, I have supplied the web link and also a QR code for two 2019 publications. The interprofessional simulation in healthcare might be an area that you're interested in. And this piece of work, edited by colleagues in Linköping in Sweden, features many well-known authors and scholars in the simulation healthcare world. It really provides a very interesting perspective, very interesting contents. So I recommend that text for you if you're interested in that area. And one on the right-hand side that I have just received my own copy, because you'll recognise a chapter author in that. And this is Healthcare Simulation Research. And this is a text that emerged from 4 previous chairs of the Society for Simulation in Healthcare Research Committee. So both of those are of interest to you, particularly those pursuing simulation-based education. Also useful guidelines and resources for developing and delivering simulation-based education from the International Nursing Association for Clinical Simulation and Learning. So there are many modules here about designing, delivering, and so on for healthcare simulation. There is a dictionary which is the outcome of many of the global simulation groups to define and align terms, to demystify terms and provide perspective that apply globally rather than country specific. And more recently is the healthcare simulationist, which is the person engaging in healthcare simulation. There is a code of ethics. So I just bring those three resources to your attention. Also, useful guidelines and resources for developing and delivering simulation-based education. These are online modules that are available. This was a collaboration by Australian healthcare simulation experts, and these are freely available modules. And what I have on the page here is the overall framework that is used in the NetSim program. And now to move to my first example of an innovative learning resource, which is simple yet impactful, and it is called Depth of Field. And it uses the technique of photo elicitation, a technique used to evoke emotive response that can help participants attribute social and personal meanings and values to foster empathic understandings of how people experience their reality and life worlds. And this, I think, is an exquisite resource. When I first came upon it, I incorporated it into the Curtin undergraduate offerings. And this was created by a nurse academic, Gabrielle Brand, who I'm highlighting on the left, the only female in that top picture, and artists. On the right-hand side is the photographer, and in the middle is one of the people featured in this audio and still picture vignette, which is a collection of artifacts, if you like, in people telling their stories. It's related to aged care, and we now use this in our curricula to prepare students who are going on their first aged care placement. And I'll tell you why I think it's really important and has positive value. It's providing a balanced perspective rather than tend to be younger students thinking that old people are ill and they haven't done anything interesting in their lives. And there are 12 vignettes which actually feature healthy older adults and making their life contributions through their stories with pictures and audio. The one we chose for our first year students was Kathleen. And Kathleen found her existing health issues are that she's had a mastectomy and she has a knee brace. The importance of choosing Kathleen was that there are still images of Kathleen in the shower. So it's providing students the visual of a naked body, an older naked body, and someone who's had one breast removed. So it desensitizes, I guess, in a way, showing students that here is someone you're likely to see in this form when you go out on clinical. But the backstory of Kathleen is interesting. This is where she currently lives, so in a supported residential aged care facility. And she has all her memorabilia around her. But as Kathleen tells her story, the social elements come into it as well. And Kathleen found herself an unmarried, pregnant teenager. And we're talking many, many years ago in country. So she would have felt the social pressures and potential isolation of being in that situation. So that personal part of her story adds to building the backstory, if you like, of this person, and helping the students understand that people have lived very rich, fulfilling lives. And some may have been teachers, some may have been academics, some may have been nurses or doctors. So it's taking away that presumption of here's an older person and I just have to care for them. And I'm going to show you now the image of Kathleen in the shower on a shower chair that our students see. So there are other pictures of Kathleen where you can actually see her, the side of her chest where one breast has been removed. But that slight exposure helps the students understand and prime them for what they're about to see. We did some research around this to build on some research that Gabrielle Brand, who created this resource, had already done with medical students. And our aim was to determine the impact of this new intervention as preparation for students entering placements in residential aged care facilities. So this was a group randomised control trial. We provided the intervention in class time. We did surveys before and after the intervention. But there was facilitated group discussion before the vignette was then provided to students. And it was very interesting seeing their responses. Many of the students had exposure, if you like, to older people through grandparents. But there were some interesting cultural differences. And in Australia, we have perhaps up to 35% of international students, largely from Asian countries. And the difference in the way that the broader family, incorporate and care for their older generations is quite different to what those students experience in Australia. So that was an interesting telling point for us as we move forward. This is the survey that we used, the pre and post, and it's called the Geriatrics Attitude Scale. It was adapted from Rubin, 1998, because we had to modify what older person meant, and we moved it to 70 from 65. And we just modified some of the wording in relation to elderly patients to older patients, which seems to be a more contemporary terminology. And the ones in red, these are 13 items, the ones in red are what we found to have significantly improved after the intervention. So students believed that older people can be pleasant to be with. If I have a choice, I would rather care for younger patients than older patients. That was a negatively reverse worded question. So you can see there was, we're very happy with this impact of this intervention. And this manuscript is currently under review. The focus groups that we also had, we wanted to get some more qualitative data to support what we were finding in the surveys. And there were three themes that emerged really from the focus group discussions. And one was preconceptions. So I mentioned before about even if students had grandparents that they were actively seeing, that some of their colleagues were a bit disparaging when they were telling them where they're going on their first placement, particularly if they were non-nursing. And they were saying, oh, really, you're going to care for oldies? So the students themselves, plus the peer pressure, had some preconceptions about what it might be like on this first placement. And this changed quite a bit. The next one was students felt a little emotionally unprepared for what they were about to see. And I'll give you an example here, which again helped us to see what we needed to add to our curricula. And in some of these aged care facilities, there were people suffering from dementia. And starting a conversation over and over a number of times, perhaps 5 times within 5 minutes, was a bit frustrating for the students. So that's an area that we would like to expand and help prepare students for when they go out on clinical and care for people who have dementia. And the final theme was connecting with older people. And the students told us that they understood the importance of getting their backstory. So they would ask the residential aged care participants what they did and what their family was like, purely as a result or perhaps enhanced by the intervention of really taking an interest. And what that led to was a quicker engagement of the older person to trust this student and then give permission for them to provide care. So we were really encouraged by that. I'm going to just show you some references in relation to this work. Gabrielle Brand, the top paper on developing this resource. This is our research, which is under review. And there is the reference for the GAS, the Geriatrics Attitude Scale, if you want that primary reference. The second innovation is the Virtual Empathy Museum. And this was a wonderful initiative that I was asked to partner in. It was led by Tracy Levitt-Jones from University of Technology, Sydney, which was actually where I used to work. And there are hyperlinks here, so I'm going to help you explore a little bit more about what's behind each of these 6 entry portals. There's 7, actually. And I'm just going to, for a minute, take you onto the next page, which lists all of the resources behind each of those portals. So there is a reading room, a film room, an art room, a simulation room, digital storytelling room, and a resource room. And you can see that there are topics down the left-hand side, and you can see the content that's dispersed across all of those cells. I'd like to take you into the digital storytelling room and also take a little look in the simulation room and give you an idea about what we contributed as one group of many within this. The key theme here, and it's in a poster hanging down from the right-hand side, is take a walk in my shoes. And some of you might remember To Kill a Mockingbird, and that was a quote that Atticus Finch, who was the lawyer, gave to his young daughter Scout when she was saying something about someone else who was on trial. And her father said, "You don't really know someone unless you take a walk in their shoes or actually climb into their skin and walk around in that skin for a time." So I'm going to move to this hyperlink and just show you the different rooms. There is the digital storytelling room and the simulation room. So let's go into the digital storytelling room. And here you might recognise John was from Depth of Field. He was the person shown in the picture with Gabrielle. So I'm just going to move this over here. And there are other stories about someone being homeless. There is the story about an older person who has medals on them, and people might think that they were in the war and he had lost a limb during the war, but he actually has diabetes. And other stories about trauma and refugee and domestic violence. So there's some very interesting different stories that have been curated for this museum. Okay, in the simulation room, so I'm just going to take you to that space and show you some of the work that we contributed to this virtual empathy museum. And we focused on someone who was obese, but the term is recommended through the National Medical and Health Research Council in Australia. The term is recommended to be larger person. So here is the story of Justin Davis, and there are a number of other stories here. There's older person, there is someone with acquired brain injury, someone with cerebral palsy, someone who hears voices, mental health focused simulation, and someone who is from a developing country and someone from Australia who was unwell and found herself in hospital in a developing country. So there is many. It's a gift that keeps giving, as I call it. So I suggest that you explore this. Again, there's the QR code, and up the top is the virtuallyempathymuseum.com.au. And I suggest you go in there and have a good look. Just to expand a little bit on the focus that we provided for the Virtual Empathy Museum, which we were concurrently doing at Curtin University. In addition to providing an e-simulation resource, we also did a film review on What's Eating Gilbert Grape, story of a very large mum whose son one of the sons was Johnny Depp. One of the other sons was Leonardo DiCaprio in one of his premiere roles, just entering into film. So it's an interesting story. So you've got the link there to the Virtual Empathy Museum. So go in and have a look at the film reviews. And there are two. What's Eating Gilbert Grape? And that's linked to our focus on obesity. And the other one is there was a series on Australian television called You Can't Ask That. And one of them was about fat. Others are about gender differences. Others are about mental health issues, gay and lesbian couples. And so it's an interesting space. And we wrote a film review about fat. As a little bit of background, you understand that overweight and obesity, I'll stick with that term because it's fairly commonly used, is a global problem. And here is an interesting map. There's the link there. And if you go into this, you can hover over your country and it will give you the percentage of overweight in the population, and that will break that into male and female. So it's a very useful resource to highlight the ever-increasing problem of obesity and, of course, non-communicable diseases that are linked with that. So we felt that that was a health priority that we wanted to focus on at Curtin, but we also contributed this to the wider Virtual Empathy Museum. You can see the United States there, parts of Africa where and Mexico down here, where the price of a bottle of Coca-Cola is much, much cheaper than water. So that's some telling ethical dilemmas in health and also profits of companies. Just some research to inform this was that several publications here showed that health professionals' biases towards people who are larger indicate that people believe they are lazy, stupid, worthless. Health professions can sometimes use derogatory and cynical humour without really understanding the impact of that on the person, who can hear, if they're in the doctor's waiting room, for example, they can hear all of this that's going on. Or if someone is speaking in the corridor in a hospital and it comes through to that person hearing it in the room. So some of the interventions that have been put forward in health curricula and also continuing professional development is more of the terms being weight neutral versus weight loss approach. And some initiatives using art and stories is one example is The Most Massive Woman Wins. So that's quite an interesting story. There is the reference for that. So that's an area you can explore further. Here, another piece of literature, more recent, challenges in caring for morbidly obese patients in the intensive care unit. And here it's related to the ventilation treatment, caring and turning them, the propensity for pressure area, and keeping people comfortable and safe. So these are the literature that informed our initiative to move forward with providing or leveraging of within discipline simulations that were existing and combining this for an interprofessional simulation with 4 professions students. So a case study was agreed upon that would provide benefit for nursing students, physiotherapy students, radiation therapy, oncology students, and occupational therapy students. And they were the 4 groups that we brought together in the interprofessional simulation. So here is Justin's backstory. We purchased an obesity suit. It's called an obesity shirt. And we have an actor called Patrick who played the role of the patient. And we brought the students all together. This was an additional activity, not for credit. And we had people, Alison Kelly was the lead, Dr. Di Dennis was from physiotherapy, and Sharon Keesing from occupational therapy. And it's a bit hard to see, but we initially played, we created 2 videos of Justin in the hospital, and the idea was focusing around what things do you need to consider for Justin going home. He's got several health issues. Several social issues. He's divorced, and he has limited friends. And his mobility, of course, to get to appointments is impacted now because he has an ulcer on his foot, in addition to colon cancer. So here is Justin, and he's in hospital. And you can see there, I've got the QR code and the YouTube link to go to that material, and you can have a look and just see what we've created there. And the trigger questions and material were to get students thinking about more understanding more listening, more empathic ways and approaches in managing and understanding Justin's condition. In the interprofessional session, in that big lecture theatre, we then had 4 questions. Each group looked at one question. We had about 10 groups, and they were a mix of all of those professions. So the benefit was understanding each profession's contribution to planning discharge for Justin. Then Justin entered the room. We had the actor come to the lecture theatre on the day, which provided an opportunity in character for the students to ask questions of Justin. And then the academics were facilitating dialogue and answered and triggered further questions for the students. We also provided a number of resources, and Beyond Blue is a mental health counselling service. The Cancer Council of Australia, but statewide, it's Western Australia resources, and a number of other resources that would help students broaden their perspective and understanding about Justin's needs after he walked out of the hospital door. The evaluation that we did was the Comprehensive State Empathy Scale and the Readiness for Interprofessional Learning Scale, the Ripple Scale, and some of you might be familiar with this. The future ideas for us were, we were concerned that we were featuring someone who was in one weight category and not acknowledging people who might have been bulimic or anorexic. And what's that perspective in the population? What's that representation? But also, are we focusing on one extreme, and should we be focusing on weight and nutrition in general? So that was a bit of an ethical dilemma for the group. But we proceeded with the obesity focus because that at the time was what was in curricula, but it will give opportunity for other areas to pursue. And a publication is in progress. There are some of the references that you might find useful. So, in summary, there are really many emerging examples of how you can use technology. What I've showed you here are just a few examples of exciting projects that we're working on. And these can be incorporated into a flipped learning approach, a blended learning approach, either with students or as continuing professional development with practicing clinicians. And the rush forward, the amazing use of augmented reality, virtual reality, and mixed realities is just at such a fast pace that I just give you a warning to exercise some caution in evaluating how much benefit going down any of those pathways will provide. There is often a propensity to buy a lot of goggles, a lot of VR goggles, and numerous examples like simulation equipment of buying the kit, but it's not wrapped around a project necessarily. So the equipment tends to just sit there. It may not even make it out of the boxes. So that's just a caution that I've personally experienced, others have as well, and develop a project to wrap it around and evaluate before moving forward. That's our experience anyway. You might have different experiences. But in summary, I wanted to just highlight that As we know, it's a given, technological advances are rapidly transforming educational offerings, but we need to make sure that the intent and the message remains clear and focused. Low tech can provide a high level emotional learning, particularly in the practice disciplines. And I think that's important undercurrent. Safe patient care is central to learning of and about practice. And as I mentioned, a careful curation of educational initiatives. And when I say less is more, it points to the second dot point here, that low tech can provide a high level awareness, memorable learning experiences, just as much as high tech things can as well. So I'm coming towards the end of my presentation. I have examples here of my Twitter handle and my ORCID ID and my email address if any of you would like to contact me, and I'd be happy to answer any questions going forward. So thank you so much, and I wish you all the best. Happy for you to explore those links and happy to address any questions going forward. I hope to one day see you in person in Hong Kong. Thank you very much.